ma'am. I think so. Yeah. Oh, to the airport. I'll call him. So after we do the video, you want me, I'm going to say before we do the video, provide a little context about yesterday's
Yeah.
preliminary.
And I'll talk about 19 teams.
And then I'll say, all right, well, let's get going, right? Let's get.
I think we're live.
All right. Welcome to Simucast, live from the floor of the National Conference on EMS in beautiful and exotic Atlantic City. I'm your host, Mike McCabe, and to the right of me is the woman who needs no introduction at all. She is the founder and president of 579 Solutions. That's Mrs. Jennifer McCarthy. Jen, thanks for being with me.
Hi, thank you. It's always nice to be with you, Mike, back at a Simucast talking about important topics relating to EMS.
Jen, it's pretty amazing to believe that this is the 9th year that you are doing this here in Atlantic City for the EMS agencies as you put on this every year since that time. And I know so much goes into it. So maybe you just touch upon that a little bit.
Well, we start our planning session December 1 the prior year, and we spend hundreds of hours actually planning, designing, fine-tuning, brainstorming, buying supplies, but all of this would not be possible if it wasn't for our sponsors. They come through every year to make this financially possible. I want to start with a huge thanks to Gamard Scientific, who provides us with mannequins that allow us to have this advanced process in simulation. They've brought over $800,000 worth of assets this year, so it's a pretty complex situation we went through. Also, big shout out to Hantevi, Inspira Health, EMSC, Seton Hall University, 579 Solutions, and a special thanks for the contribution from 3M Littman.
For sure, without the sponsors, this would never be able to work, and we are so grateful for them. The question I have, and I think everybody probably has at this point, is whoever's watched this over the last 9 years realizes there's a lot that go into these scenarios, and there's humor, and it's deep as far as the medical side of it. Can you just explain how you come up with these scenarios?
As long as I don't end up referred for psychiatric evaluation, I'm happy to talk about it.
Too late.
These scenarios are ripped from the headlines. They are events and stories that I have either experienced or been told about or read about, and then we embellish them. When our prelim situation had 10 times that we were watching the same scenario, part of the humor piece is the engagement of the assessor so that they don't lose interest, because that inter-rater assessment is key to our success. So there's many levels that go into that design.
I know that Gary worked really hard on the video, and we're going to watch it in just a second, but before we get into that, maybe provide a little bit of context about the preliminary competition yesterday.
The prelims always warm my heart because teams from across this country come to compete, and they take that competition part very seriously. We had 19 teams show up yesterday, and we had 2 rooms running. They had practiced countless hours with their organizations and educators preparing to come. The top 3 teams on both the BLS and ALS levels moved forward to this evening, and that's what we're about to see live, is the final competition.
Well then, with no further ado, let's get to the video that Gary worked so hard on so we can show this.
Wonderful.
Through the science of simulation, scenario architects craft carefully researched experiences that grant teams an opportunity to practice the actions and interventions required for real-life situations. The edifying discipline of simulation in healthcare transcends former instructive boundaries. It is remarkable when education and clinical practice can intersect in such a meaningful way.
My experience today was really fun. It was the first time I delivered a baby.
In 2023, the National EMS Quality Alliance, in partnership with the National Association of State EMS Officials, launched 10 new measures to improve patient care and safety in critical and high-risk areas, emphasizing age-specific airway management. Measuring clinical quality is crucial for the safe delivery and growth of emergency medical services, as it is impossible to improve what we do not measure.
I support simulation education as a modality because it supports and builds up team work. It improves closed-loop communication, as well as keeps teams up to date on latest practices in the country.
In the preliminary round of the 2023 simulation competition, crews responded to the Catawba Birthing Center, where competitors were immersed in a live childbirth situation while managing the mom's precipitous delivery, a depressed newborn, and their composure under pressure.
Do you mind having anybody who doesn't work here just step out of the room for me?
No, that's against our practice.
Teams unexpectedly found themselves facing a potential second birth.
I get this sharp pain, but it comes and goes.
Okay.
Like it's all gone now.
It is in these profoundly challenging moments emergency medical services clinicians shine. They lift the fallen, restore the broken, and heal the hurting while maintaining composure in situations riddled with pandemonium.
Just not right now, okay? We have to do our job, okay? So,
The teams participating in the 2023 simulation competition are inspiring professionals with remarkable talent and unwavering determination. Working calmly under pressure in low-frequency, high-risk, patient-centered events, these EMS clinicians prioritized patient safety, demonstrated clinical excellence, and calmed the chaos.
Stay nice and calm. I know this is a really overwhelming situation, but you're doing really well.
EMS crews that advanced to the finals succeeded by implementing a back-to-basics approach. They established concrete communication and knowledge sharing with all members included in the team hierarchy.
It's face down. It's face down.
it's face down.
Knowledge shared is knowledge multiplied.
Just breathe.
Awesome job, Gary. Without any further delay, let's get to it. Our first BLS team is Tom's River First Aid, and our first ALS team is Holy Name ALS. Take it away.
Unit 399 from dispatch.
399.
399, respond, Anywhere Township, County Road 579, 579, to the Happy Catawba Farm for the special event standby.
Received. Responding for the special event.
Received 1809. dispatch.
ALS in service for you.
ALS from dispatch, respond. Anywhere Township, County Road 579, 579 for the incident at the farm.
Received. Injury at the farm. Responding.
We apologize. This is about their scoring, though. This isn't where it So we don't have...
Yeah, we don't have any. I mean, there's nothing we can do.
If you just bring this up and I lay this on the hay bale, you would be, if I just put this on the hay bale and you bring this mic up, you can pick up some. Because that's a.
The actual plant.
This is what I got out of his mouth. That's what I got out of his mouth, and then he threw up.
As soon as you're,
I'm gonna go around to your left.
yeah, as soon as you're able, I just need to go grab an ice pack for the distractor patient. So if you can take over bagging once you have him on the monitor.
Yeah, just give me a second to put him on the monitor.
I'm going to check on my husband.
Okay, that's great. You do that.
He's fine.
Thank you so much.
That kid, he doesn't look too good.
Oh, that's my grandson. Don't say that. Don't say
I hear an apple a day keeps the doctor.
You guys have any bandages?
So go ahead. Eat that. That might
I'll take that shirt you're cutting off of him too.
You want a bandage?
Yeah.
For what? For your
My hands are burnt.
All right. Give me 1 second, okay?
There's something.
What are they doing to the boy?
I don't know.
And that
He don't look too
that
good.
man was on fire.
And how old is this kid?
5.
5? All right.
They want us. They said to move. They said to move her.
No, don't move her, and we'll take that. Thank you.
Are you doing a great job bagging there?
Yeah.
I'm gonna set up the suction. Cynthia has a suction. You have a
Suction's
suction?
right there, right by your knee.
Okay.
You're the reason all of this.
All right.
I'm gonna do this something, right? I
Yeah,
got
you
the
want
monitor ready.
You want to bag him for 30 seconds while I wrap up his hands?
Perfect. And then I'm gonna get
You're a,
Gone through IVF
I really don't see how that's our problem.
All
wearing a baby daddy shirt in public, dude.
right. I'm gonna take
you know
over
we
your
got PD
all right?
on scene?
Huh?
If you know we got PD on scene. Hey, Cynthia.
It's my hands and I
Since you
think
got
I
the
broke
radio,
my
can you do me a
head.
favor?
Yeah,
Call
like
for
my
additional
eyes.
resources, one more ambulance, and PD.
Can you see?
Yeah, I can see.
Perfect.
Put
Awesome.
that old guy out.
Listen, I understand. I just wanted to make sure that you could see.
Woo, that doesn't look good at all.
Taking very good
Is
care
this
of him.
supposed to be that fast?
Yeah, well,
We'll take care of him, sir.
I got this.
It's got all kinds of squigglies in it, though.
what are you? You're helping him out. Yeah. What are you doing? Well, when
thing is, I'm gonna call voice and control.
You know what? If we had a first aid kit, you could be doing this.
Hey guys, any of you
Just
has
saying.
a cell
You know
phone?
what? A first aid kit will be
Excuse me, guys.
a great addition.
Any of you guys have a cell phone by any chance?
I have a cell phone.
Okay, can you do me a favor?
Yeah.
I have a jitterbug.
Center, Poison Control Center, and ask them all that you
There's
know
no
about.
service.
Did you tell us no
We're
service?
so far out in the woods, I got 0 bars.
Okay.
That's by design, just in case you were wondering. What's the bigger problem?
People. Okay. 3 millimeters. Heart rate is erratic. Okay. Looks like flutter with some EVCs. And then she goes get some runs of couplets.
What do we think this was started by the way?
How we doing there?
Just gonna wrap his hands.
Perfect.
We're gonna get moving,
Alrighty.
okay?
So once we're done with him, I'm gonna set up the suction. I'm gonna bag him, and then I'm gonna set up for intubation. Right? Thank you. Yeah, I'm gonna do a. Oh, he's breathing down.
Okay.
He's solar.
No, married.
Really?
Yeah.
Is it worth it?
It is.
Okay.
I don't show pulse.
So he would be talking to me right now?
Okay, I got you.
Got it? Okay.
Trying to get your service. My wife instead. I'll go get service.
All right, sir. If you can do that, tell him that we have cardiac arrest.
What cardiac arrest?
All right, now I can help. What do you need?
If you could just go keep that woman calm.
I don't think there's enough people here to keep that woman calm. What's that? I'm not a cop.
6, 7, 8, 9, 10, 11, 12, 13, 17, 18, 19, 1, 2, 3, 4, 7, 8, 9,
You have an IO? Oh. Okay.
breathe.
Yeah, I gotta.
Nope.
I'm gonna take the medical bag from you because I'm gonna need it.
You let me know if you want to bring him. I can't.
19, 20,
I got some.
5, 26, 27, 28, 29, 30. Breathe. Breathe.
I'm all fixed up. Is there something I can do?
We have a rate of 33. 28. He's breathing back down.
If you don't feel one, it's all right.
Yeah, but this is.
You had a pulse with it?
Yep. You want to confirm, but I feel the pulse.
You do?
Yep. And look at he's.
Yeah.
Let me get the pads on him.
And I'll give you the cables. I'll start pacing him.
Pads on the mannequin go on that.
Johnny.
Pads go for the
Yeah, the tablet. Okay.
for the. They have to go here and here. I just wanted to make sure they
As
went.
close as you can. You can do put them back if you want, but it's
You should have wheezing all throughout. You should have wheezing all throughout.
Yes.
All right, I'm just gonna move this kid's arm out of the way so we can get this pad over here on the other.
Absolutely. And then I'm gonna have you go over here, ventilate him.
Yep.
And I'm gonna
No, we don't carry albuterol. Our medical director will not sign off on it.
I'm gonna stay here.
Yeah, no worries, no worries.
So,
We're working on it right now. Everything's gonna be okay.
actually, you
all
know
right?
what? Do me a favor.
We're gonna take good care of him. I promise.
Yeah, we're gonna drop an hygiene.
Guys, can you do me a favor? Can you guys just back it up a little bit, please? That'd be fantastic. Okay?
Walter, I'm gonna check on Johnny. I'll be right back.
I'll take good care of him. Okay? Okay.
In case you weren't here, he threw gasoline on a fire.
Gasoline on the
That guy
fire?
on fire. Me on fire. That kid's not on fire.
Still got a pulse. Okay.
Very good.
They're saying that he threw gasoline on the fire, which is the reason why he got burned up the way he did.
All right.
So,
Chemical burn.
yeah.
All right, we're gonna nebulize for him.
Okay.
What does that mean?
Is he gonna be okay?
What
Because
happened? I mean, there was a chemical fire?
What?
There was a chemical fire?
I mean, there was a gasoline fire.
Okay,
Because
gasoline.
my stupid employee
I know you're.
decided to
I know you're
gasoline
concerned.
on the fire instead of just putting more wood on there.
Okay, understand.
Okay.
So he lit this guy on fire. My other employee's hands are burned, and everything else is going on. I don't
still
know what
hurt.
that kid's
Now,
problem is.
Do I
but he's
have
really
it? You
sick.
guys
The
have
best
any
thing you can
drugs?
do for him is keep talking
because I think I'm going to pass out.
Why don't you take a seat for me, sir, okay?
Because if I sit down, I ain't going to be able to get back up.
We can help you up later, but I want you to sit down, okay?
Just have to get on that hip stop right there.
There you go.
I'm 75 years old.
Electrical capture.
Help him down.
I'm sure we could.
We work together, right? Thank you so much. I appreciate your
All
help.
right, all right, all right. I got you. I got you.
Good.
I got you. I got you.
Can I have
Get over
Guys,
here.
I don't know if I'm supposed to. I'm not sure if I have if we don't.
You got any drugs for my hands? I'm in a pain. That guy's not, I mean, he can't feel nothing right now.
If it's
But I can use something for my pain.
What do I tell my daughter?
You know, when in doubt, let's start doing CPR.
6 liters.
Do me a favor.
Is there anybody else that can help you guys out?
Let me see what
Dispatch has been made aware. They should be sending somebody to help, sir.
What? There's more people coming?
We'll see.
Did you open the gate?
Okay, 6 liters.
It's actually a couple times.
Hold on.
for the pets.
What does that mean?
It's gonna.
What is it? 90 over 40 right now? Okay.
90 over 40.
90 over 40.
Okay.
Currently, he's got like 2nd degree burns. His airway's still painted. We started nebulizer treatment.
Still got a pulse.
He still has a pulse.
Okay.
So we're keeping him warm, right?
Yeah.
We've covered everything with dry dressing.
I know, man. We're gonna try to do our best. I promise you. Can you do me a favor? See, do you know how to do CPR? All right, we're gonna teach you today.
I really appreciate the help with that, okay?
Yeah.
Yeah, no worries. Yeah, I'm going to make sure he's going to be okay. 58.
Your gun is by your name.
He's only 5.
Hey, this lady's about to give birth.
We are helping you. I promise. I'll be there in a second, sir.
Nobody knows.
She come
You want me to
first.
start bagging him?
He's only 5.
I am not a doctor or anything, but that doesn't look like that.
What do you need me to do? I can breathe. I know mouth to mouth because I can breathe.
Don't do that. Don't do that.
Let me get rid of my dick. I'll be the first.
No. Stay right there.
Just jump in our gym.
We do got cattle coming through here in about 30 minutes.
Are you guys gonna go soon to the hospital or something?
Hey, can we get an end title on him?
Yeah.
Okay.
I'm just like, once you put
So
the,
we'll stand out back.
just do the agile.
Back there.
Help me out and I'll go right back to you.
Got a metal bed in the back for horses. Can we go back there?
It sounds like he's
That
moving
guy
something on the
set
fire.
it on
Take
fire.
care of that. Like, don't even worry about it.
Hey, we got a rate of 48.
Excuse me. My wife twisted her ankle. Are you able to help her? You got to give me a few moments, my. I gave you a few moments. I had some more critical
Hey,
things.
that doesn't. That looks different.
Yeah.
That looks real different. Yeah.
Bag him.
Yeah. Just drop the agile as soon as you can.
Is he gonna make it? Because I just need to know
We're
that.
going to do everything we can do.
Yeah.
Okay? Yeah, absolutely sure.
Time.
You are a hard thing to do. I tried. I've learned that you guys are the person to talk to them, so that's why I'm.
We need a representative from each team. One representative this way.
Oh, yeah, I'm sorry. Yeah, that was actually for the hand tabby. No, it's the other one. Oh, I'm sorry, this damn thing is big. Oh.
Do they want us to leave our interventions as they are?
I'm sorry, it's beeping because we got.
Oh, did you? No, not my. Oh, yeah.
No, it's beeping, so I know the pads are connected. I don't know if you guys want to shut it off.
Hey, how are you guys? I'm doing well.
Everybody on the stage, lower your voice.
What's your name? Cynthia, nice to meet you.
Alyssa.
Alyssa, nice to meet you. Don't worry about it. You guys did a fantastic job. So first and foremost, great job. Congratulations. Take a deep breath. I know it's chaotic, right?
I'm gonna take my afro off. And my stupid headlamp.
All right. So let's talk a little bit about the scenario, right? So from the BLS perspective, as you walked in through the door, I want to know what it was like as you sized that scene up. As soon as you opened the door and you looked on stage, what were you thinking?
Oh, okay. I'm definitely loud enough without a microphone.
All right.
But, so I walked on scene and I was automatically anticipating a chaotic scene. Fires tend to bring out the worst in people.
Sure.
Could see that there were multiple patients, at least a couple of BLS, the ones that were yelling and screaming, and a couple of ALS, the ones that weren't yelling and screaming.
Right.
So we needed to get some fire, get some additional BLS units, get some additional ALS units out there in the perfect scenario.
Now I noticed you were tending to the child, correct?
Yes.
Right. And so that was kind of a situation where you probably had no idea what was going on initially. Had you ever heard of Foxglove or anything like this? Okay.
As soon as I
great.
saw that it was Foxglove, I knew exactly what was going on.
That's great.
Yeah, because Foxglove it's digitalis and it's the derivative plant for the medication digoxin.
Awesome. So that's great. I mean, from the ALS perspective, now you were on the other side, right? You had the burn patient. I'm going to have you step in front of the mic.
Okay.
And so why don't you talk to me a little bit about when you came through the door? And did you know exactly where you were going to go, which patient you were going to tend to, how you were going to split up?
Yeah, so when we entered the room, I immediately looked around, did a scene size up, noticed that there were a couple patients that were going to need our attention. Was trying to figure out what causes the injuries to them.
When you finally got up on stage, you were able to approach your patient. What was your main concern as you approached?
My main concern was just to make sure that patient, kept an airway, we kept him warm, we kept him dry, but definitely keeping his airway and whatever mental status we had.
So, at burn patient, right? Any special considerations? As you know, we have burn patients. It's not necessarily. It's probably a high acuity, low frequency type call, especially what you had. Any special considerations with burn patients that you were thinking while you were up there?
Yeah, of course. I was thinking about making sure that he would continue to keep his airway, of course, because that's really imperative in a burn patient. We know that there could be impending swelling that will eventually occur.
We'll find somewhere we could put it.
Guys, you did an awesome job, and we want to thank you for doing it. Number one, it's not always easy to do, and we really just want to applaud you on the effort. So thank you very much.
Thank you so much. Thank you.
Thanks, guys.
All right, for everybody who's live in the stream world, we're going to be going to a little bit of house music till we get our next team up and running. So thanks so much. Donnie, we're going to make the switch over here. If you could lower the music, please. Bill Capella, good?
Welcome to Simucast, live from the floor of the National Conference on EMS in beautiful and exotic Atlantic City, New Jersey. I'm your host, Mike McCabe. To the right of me is the woman who needs no introduction. She is the founder and the president of 579 Solutions, Mrs. Jennifer McCarthy. Jen, thank you for joining.
Hi, everyone. Welcome. Once again, welcome. It's always great, Mike, to hang out and talk about all things EMS.
Jen, it's hard to believe that this is your 9th year putting on the simulation here at the conference for all the EMS agencies. I know so much goes into it. Maybe just touch upon a little bit of all the work that goes in and everybody's effort all the time.
Sure, thank you for the opportunity. We actually start planning on December 1st, the prior year, and we work countlessly from December till literally today. It's hundreds of hours, but the reality is none of this would be possible if it wasn't for our sponsors. I want to give a huge shout out to Gamard Scientific. They brought over $800,000 worth of assets today for our simulation yesterday and today. Also, big shout out to Han Tevi, Inspira Health, EMSC, Seton Hall University that supports my time away from my full-time job for the week, 579 Solutions, and lastly, the contribution that was made from 3M Littman.
Obviously, our sponsors, we couldn't do this without them, so thank you to them.
Thank you for the round of applause for them. Thank you.
Jen, I think the question that everybody's going to have is anybody that's come to these over the years can see all of the crazy scenarios that you come up with. And I think the question would be is, how do you conjure up all of these things in your mind?
So I'd be happy to talk about it as long as I don't get referred for psychiatric care at the end of this simu case.
It's too late.
Actually, these situations have been ripped from the headlines. They're emerging topics that we embed and utilize for teaching purposes. My belief about healthcare simulation is it drives patient safety and clinician safety. So Dr. Couture and I do a lot of work thinking about topics that are important to expand everybody's understanding, but most of the base of the stories are actually ripped from the headlines, situations of over my 30-year career I've been faced with, and then they're embellished to have a comedy aspect to keep us all engaged, because assessment can only be accurate if we're engaged the entire time.
Very true, very true. Now, I know Gary put together an incredible video, which we're about to watch, but before we get into that, maybe provide a little bit of context about the preliminary competition yesterday.
Yeah, it's remarkable. The day before, and I think it's important, we all come into this ballroom and we think, what happened yesterday? 19 teams showed up after hundreds of hours of prep with their organizations, their EMS educators, and they came to be the best of the best. And the top 3 BLS teams and the top 3 ALS teams moved forward to tonight to compete to the rights to carry the trophy and have their name etched in the base of it. But I want to acknowledge all the people in this room. I think the greatest part about this competition is the energy. If you competed, please clap. Just you, yourself. I want you to clap for yourself, and everybody around, look at the number of competitors that came here to, yes, keep clapping so people can realize you came here to see your coworkers compete for something that you didn't move forward in. That's the energy of driving change in practice, and EMS is all about that. We can only be the best that we can be when we are united as one. So thank you to the competitors who came yesterday, and I think it's time to go to Gary's amazing video.
We'll let you go do presidential things while we watch the video. Gary, take it away.
Through the science of simulation, scenario architects craft carefully researched experiences that grant teams an opportunity to practice the actions and interventions required for real-life situations. The edifying discipline of simulation in healthcare transcends former instructive boundaries. It is remarkable when education and clinical practice can intersect in such a meaningful way.
My experience today was really fun. It was the first time I delivered a baby.
In 2023, the National EMS Quality Alliance, in partnership with the National Association of State EMS Officials, launched 10 new measures to improve patient care and safety in critical and high-risk areas, emphasizing age-specific airway management. Measuring clinical quality is crucial for the safe delivery and growth of emergency medical services, as it is impossible to improve what we do not measure.
I support simulation education as a modality because it supports and builds up team work. It improves closed-loop communication, as well as keeps teams up to date on latest practices in the country.
In the preliminary round of the 2023 simulation competition, crews responded to the Catawba Birthing Center, where competitors were immersed in a live childbirth situation while managing the mom's precipitous delivery, a depressed newborn, and their composure under pressure.
Do you mind having anybody who doesn't work here just step out of the room for me? No, that's against our practice.
Teams unexpectedly found themselves facing a potential second birth.
I get this sharp pain, but it comes and goes. Okay. Like it's all gone now.
It is in these profoundly challenging moments emergency medical services clinicians shine. They lift the fallen, restore the broken, and heal the hurting while maintaining composure in situations riddled with pandemonium.
Just not right now, okay? We have to do our job, okay? Okay. So,
the teams participating in the 2023 simulation competition are inspiring professionals with remarkable talent and unwavering determination. Working calmly under pressure in low-frequency, high-risk, patient-centered events, these EMS clinicians prioritized patient safety, demonstrated clinical excellence, and calmed the chaos.
Stay nice and calm. I know this is a really overwhelming situation, but you're doing really well.
EMS crews that advanced to the finals succeeded by implementing a back-to-basics approach. They established concrete communication and knowledge sharing with all members included in the team hierarchy.
It's face down. It's face down.
It's face down?
Knowledge shared is knowledge multiplied.
Just breathe.
I want to take a second to acknowledge Gary Ackerman and the work that he does every single year on that video. Thanks, Gary. With no further ado, our second competition group, the BLS, is JFK BLS 1, and our ALS team is Atlanticare. Take it away.
JFK BLS from dispatch.
JFK BLS, go ahead.
JFK BLS 1, respond. Anywhere Township, New Jersey, County Road 579, 579. For the special event standby. Acknowledge.
Received and responding, sir.
Here by the fire. I'm sure they're going to start it soon. I'm going to see what Jimmy is up to, okay? Johnny, what are you getting up to over here?
Excuse me, sir. It's really cold. Can you get the fire started?
we're outside.
Yeah, but it's cold.
Where's your jacket?
I don't know.
feel like I'm a parent. You're gonna be a father and you can't bring your own jacket?
Well, she's got a jacket. I don't. Can you put something on the fire?
Hey, this guy wants some more fire. Go get some wood. Yeah, where's the wood at?
Listen, we don't need to worry about wood, all right? I got it, okay? No, it's fine. It's totally fine.
Please get this fire going.
I'm gonna put it.
Oh my God, look. You got Pop-Pop on fire.
What'd you just do?
Shit.
I was trying to make a bigger fire. What do you want from me?
Ah, my hands are burning.
Listen.
Are you gonna help?
I'm not to help him. I don't know what to do. Listen, help is coming, all right? Just relax, all right? You wanted a bigger fire, I gave you a bigger fire. Relax, all right? Listen, did you get
Are you kidding me?
It wasn't me.
Look what you
Still
did.
burning.
He did it.
I'm burning.
There's no way. There's no way he did it.
This is not my
He
fault.
told you to go get more wood. What'd you do?
Stay there, Gerald.
You poured your gasoline on it?
Yeah, it's
Walker.
fine. I thought it was gonna be fine. Somebody, listen, just relax, okay? Somebody's coming.
Somebody help, he's on fire.
Would you put
Yo,
it out there?
jacket boys, you gonna come over here and help?
Put out the fire. Listen, guys, we need help. all right?
Okay.
Oh, his bottom parts are on fire.
There's people over there. Who needs help?
So what happened?
Gasoline on that fire.
Okay, and then the fire exploded.
On it, you put gasoline.
Smoking over here.
Is anybody else hurt? Okay, we're gonna go take a look at her in just a second. We'll make sure that he's okay, all right? Kiefer, what do you have so far? All right, let's just get this exposed for right now. She looks like she's breathing. Are you good for this for a moment? I'm just gonna make sure that they're okay, all right?
Can I have something for my hand?
All right, yeah, what's going on?
My wife, she twisted her ankle.
Okay, ma'am.
Aries, all right?
Ma'am, take a deep breath. Take a deep breath. We're here to help you. We'll be right back to talk to you, okay?
Wait, no, but what are you going to do about
Can
it?
you need to help your wife to breathe and keep her calm, okay? You stay with her. I'm gonna be right here in 1 second. What's going on?
He was eating this, and I got it out of his mouth, and he says that it's poison, and he threw it up.
Okay.
But I don't know how much that he got.
How-
He's not talking to
how
me
old
now.
is your son?
He's my grandson. He's 5.
Okay, and how much was he eating? You saw him
I
eating
don't
this?
know. I just came over and he wasn't acting right. I got this out of his mouth and I made him throw up, and he started throwing up. That's my husband over there.
Okay, I'm not feeling a pulse and we're supposed to be
Right there. I can't be everywhere.
whatever I feel. Okay.
He's not acting
All right, ma'am.
talking to me.
All right. We're gonna start CPR on this. We're gonna reposition his airway. How old is your son?
He's my grandson.
He's your grandson. Okay. All right, take a nice deep breath. You're gonna help me take care of him, okay? We're gonna help your son. Right now it looks like he's having some trouble breathing, so we need to start CPR for him. Okay. Hey, Kiefer. Kiefer.
What is going on with my husband?
Are you related to them at all?
Yes, that's my husband, and this is my grandson.
We need to help this kid out right now because he's not breathing really well. I know it's very overwhelming. Let me help this kid, and then once we get a couple more hands in here. I know.
Why are they pushing on the kid? What's wrong with the kid?
We're just helping him because right now it looks like he's not breathing.
What's that?
Hey, Kiefer?
Can I check on my husband?
Yes, can you go check on your husband? That would be really helpful. Yeah, go check on your husband. Ma'am, how you doing over there? Nope, we're helping him right now. He's doing okay.
I have a feeling you're not.
Kiefer.
I thought you were gonna hold me.
You're gonna get on fire.
Matt, we got one CPR in progress with Colette. Matt, what do you got? Matt, what do you got? Burns? Okay.
Hey, Matt.
Okay. Yeah. How many other patients do we have?
Matt.
Where's the bilateral hand burn? All right. What's your name? Nicole, grab your staff member with the bilateral burns, put him on there, tell him not to move for me. Yeah.
All right, so 5-year-old kid, he was eating his poison over here, was vomiting, and then became unresponsive. I don't feel him to have a pulse. I'm not able to assess anything else right now, but he's pulseless. I started CPR, okay?
Yeah, I saw that. Yep, I got you. All right, you ready? Which way you going? Right?
Can you just get me? I just need to get some airway stuff for him, and then I can have the grandmother manage with me. But we don't have. I don't have any oxygen on.
Okay, I'll be over with him in a second. Matt. Roby. Did you check her out? Did you check her out? Is she a patient?
I need the. Are you guys using your oxygen?
Ankle?
I need a pediatric BV
Okay.
and the oxygen. They only have the vent one. Okay.
All right,
Can I
so
have some bandages for my hand?
1 second, boss.
Do you guys have pediatric airways
All right,
in
so,
your bag?
okay, let's get your suction set up. We're gonna get a baseline set of vitals. I need to get an IV. Yeah, just make sure he's got a clear airway.
Hey, ma'am, can you do me a favor?
Yeah.
You need to sit down because I don't want her to have a.
He ate foxglove? So it's a dig overdose? Okay, great. What's your name?
All right,
Yeah.
so we don't have any oxygen
Evan,
up here.
okay, listen to me. I want you to go
Hey,
over
Grandma,
to
come here, come here.
this
Sit
bag.
down, sit down.
Kiefer's
Take a
gonna
deep
show
breath,
you where an
okay?
ice pack
Come
is.
here, you sit down.
We're gonna give you an ice pack to put
We
on your
didn't get
wife's
any-
ankle.
Grandma, it's okay. Take a deep breath. Take a deep breath in through your nose, okay?
Matt, you got the radio?
They have to go to the same hospital.
Okay, we'll make sure that that happens, okay?
Count.
Take a nice deep breath in through your
Count
nose.
accumulated ALS.
Take a nice deep breath in. Grandma, what's your name?
Can somebody help me?
Can get an air medical unit for a burn and second ALS unit, please.
Do you have any advanced airway for peas in your bag? Or just like
And
an MPA or something?
3 additional BLS.
What do I tell my daughter?
Hey,
Yeah,
Grandma,
we
you're
have
doing
bandages
really
for you
well. Just
too,
sit down.
okay?
Take some
What's
nice
your
deep
name?
breaths. I know it's scary, but we're gonna take care of him, okay?
What's your name? What's your name?
Gilbert.
All right, Gilbert. We got a lot going on right now. Is anything else bothering you besides
Grandma,
your hands?
how are you doing?
Okay.
Are you okay?
I think I've hurt my eyebrows off.
Okay. Where were you when this
Can you
happened?
take over for compressions? I'm gonna breathe for a second.
Okay. Did you have any hoarseness or
We're
soreness
gonna
in your
get her
throat
another
right now?
ambulance to come take her, okay?
Okay. All right. What's your name again? Gilbert. All right. So I need you to sit tight. All right. Your hands are burnt. We're going to get to you in a minute. We need to get your buddy taken care of first.
I don't know that guy.
Okay. Well, the guy that you tried to help.
I work here.
Okay. How is he to bag?
Where's your oxygen?
How is he to bag, bud? Okay.
How bad burnt is
Pretty bad.
Don't feel one?
his junk's burnt too. I looked at it.
Okay.
I don't feel one.
So I got a sat at
All right, you
86%.
want me to continue this? We just
Matt.
don't have him connected to any oxygen, so if we can
Roby.
get that.
How you doing?
Where's your bottle? I can get it.
How you doing? Okay. Do you need IV, epi, anything like that? Okay. Hey, what's your name? What's your name? Brandon, take that red
Hey, Matt,
bag.
where's your oxygen
Go give it
bottle?
to my partner over
Matt.
there.
Where is it? I can go grab it. Okay. I'm gonna take
Who,
off
this
this and I'm
guy?
gonna go get it, okay?
What? Brandon?
Okay. Oh, thank you. I appreciate you doing
All right,
that.
Gilbert. We'll be with you in a second.
Thank you. What do you need in here?
All right. You're on high
Is
flow
this the, what
oxygen,
is this?
right?
Is this for the, okay. You need, you're what? Okay. You don't need this one right now, right? You don't
You're on
need
high
this
flow.
bag
Do we
right
have an
now, right?
OPA or an NPA
Yep.
in? All right, let's get that in. His stat's less than 50%.
Oh, well, that's not going to work on the angle. We're going to get you some
Yep,
in to
you're
fix
good.
that, though. So, ma'am, we have another ambulance
All right.
coming for you. I'm going to take a look at your ankle, okay?
Hold this.
I'm trying not to move it. I'm going to put on a little bit of a better splint in just a moment, okay?
Do you have a peep
All
valve?
right. Dad, yeah, can you do me
Okay,
a
I
favor?
got
Can
you.
you hold her leg so that it doesn't move? I don't want to hurt
Yeah,
it anymore.
yeah.
I'm going to put something better underneath there. All right, ready? I'm going to move this out, and I'm going to put a softer something underneath there, okay? Oh, what happened? Okay, no worries. I'm gonna prop it back up again, okay? Do you want it on a splint, or can we just leave it on the ground? Is this okay like this? And can you just keep
Gilbert,
the
how
hold
you
on
doing?
the ankle?
Gilbert, stay here in the chair and talk to me,
How many
bud.
weeks along are you?
Okay, that's okay.
Okay. How has this pregnancy been so far? She's gonna be fine. We have another ambulance coming. I'm getting it. I'm getting it.
Okay, I'll be right back. I'm gonna get you a peep valve.
When did you fall? We're not gonna have this baby right now. We're gonna make sure.
And I don't
okay?
have capno. Will I have capno?
Oh, oh, let's not do
67?
that.
Okay.
Here's your oxygen. Hey, Dad, do me a favor. Can you
How you
hold
doing,
this
Colette?
ice on her nice and soft because we don't
Colette,
want it to hurt her
how you
anymore,
doing?
okay? What do you need?
How you doing?
Good. I'm gonna help him back over there.
Okay.
If we can just get these guys busy, let's see. What happened with you, sir? Come take a. What happened with your hand?
I put that guy in.
Yeah, let's go sit down together. Come here.
Please
Let's go
don't
sit
reach into
down.
my bag.
And I'm gonna take a look
Thank
at your
you.
hand. Okay, let's come sit here.
Okay, ma'am, I'll be right
Have a
back
seat
with
right
you.
here for me. Let me see your hand. All right, let me take a look at your hands here.
I can in a second,
Are you
yep.
hurt anywhere else? Okay, are you singed anywhere else in your mouth? No, okay. Are you having any trouble breathing? Oh, okay. Are you having any trouble breathing?
Always.
Oh, you always have trouble breathing. Okay. I'm going to help out the little kid over there, and then I'm going to come back with something for
What's the
your
rhythm,
hands, okay?
PA?
I'm going to come right back, okay? We have another ambulance coming to come help you. Can you just keep an eye on him for me and make sure that he stays
Okay.
sitting, okay? Thank you.
Where's Colette at?
Yeah, I appreciate that. If you could do your best, okay?
Colette, can you help Matt out? Matt, just go with ACLS right now.
So
I'll
that's
be
just
with
like
you once we get this
a
guy
BOS.
intubated. Sir, back
What
up.
do you need, Matt?
So right now, Brandon, your job is to help Gabriel, okay? We're trying to help Gabriel, the hand guy. Yeah. Why not? Okay, well, just because he started it doesn't mean you don't deserve to help him now, right? Maybe it was a mistake.
It wasn't a mistake.
Okay, well, we'll get there.
All right, hold on, Matt, take this. I need to stop. I don't want them to go mess with her over there.
Okay.
Yeah, they're
So-
taken care of. Hey, sir.
Yeah, so can you pop a nasal cannula on him at 15 liters a minute? How you doing, Matt?
Grandma, you're doing a good job. Just stay sitting.
Okay.
What else do you need right now? You want this one too?
Can I do something over here? We have a metal table in the back we use for horses.
Brandon, so tell me what's going on about this incident right here.
That guy started this fire.
Intentionally?
Listen, I'm not a doctor, but he's bad. That guy did. You should go talk to him about it right now.
Yeah, I can. Can you have...
We're
Okay.
gonna make sure that they do okay. We have another ambulance coming.
Bandages on my hand. Just hold him like that. You're doing great.
So I'm aspirating to see if I'm in the vein. County, you calling it Atlantic ALS? Can you respond to the scene, just an update on those additional units?
You've been with this guy for so long.
All right, how much do you think he weighs?
He looks very sick.
I'm gonna say 100 kilos.
Can you guys help me now?
Gabriel, we're gonna help you in a second, okay? Once you see a plastic tube go down this guy's throat, we'll be over to help you.
Okay. I don't want to stop this, so the next time that you do a pulse check, we'll get some breaths.
All right, so
in.
I'm giving
2,
150
3, 4, 5, 6, 7, 8,
ketamine.
14, 15, ventilate. We have another ambulance coming, okay? Yeah, it should be here in a couple minutes, okay?
Why don't you do me a favor? You see that box right there? That's where
Who
I know.
Who are you, ma'am?
It's really stressful.
Who are you? What's your name? Sarah. All right, so Walter's been burned very badly right now. Okay, I know this looks pretty bad. Okay, so we're putting, I understand, all right? We're gonna put Walter to sleep. We're gonna put a tube down his throat.
Come here,
We're
so
gonna
you're
put him on the
gonna come right next to me,
ventilator.
okay?
And we're gonna send him to a burn center, okay? We're gonna do our best,
Have you ever
ma'am.
done CPR before?
No.
Okay, so what I'm gonna have you do
I
is I'm gonna have
understand.
you put one of your palms on top of the other, like how my hands are positioned right here. Can you see this?
Yeah.
All right, what I want you to do is just be just the rhythm that I'm doing.
Matt, how you doing? I gave ketamine, no paralytic.
Okay.
Okay?
Okay.
All right, tell me, I'm gonna have you take over my spot.
Okay. Okay. I'm helping. I'm helping. I don't. She's gonna help you.
Hey, Gabriel.
Yeah, we were talking about fast and hard. Fast and hard. There you go.
Doing really well, a little faster, sir.
Fast and hard. Fast and hard. No, fast.
That's it.
This is called a bougie.
All right, we're gonna take over, sir.
Did I help? No. Then I didn't help. Then why'd you ask me to?
You know what, can you do me a favor?
Hey,
Can
we
you
love-
just go
ma'am.
over there and ask him for an ice pack for the other gentleman
ice
and
pack,
for your wife?
okay.
Yeah, go ask him for an ice pack.
Hey, Gabe, don't touch our bags. Cool?
I'm gonna hop back over there.
Cool? No.
Yeah, we're getting
In a second.
something for her ankle right now.
Kiefer, you ready for rock? Okay. Do you have a burn sheet? All right.
In the spare bedroom.
So this is 100 milligrams. Rock.
You should definitely talk to him. I think he can hear you.
I can hear you really well right now.
Time, Endex, Endex.
Yeah, just got caught somewhere. Oh.
Thanks. Thanks. Okay.
No, the other guys.
Yeah.
I went to sit down. But it looked good there, didn't it? It did.
Knock the water out of my hand.
Your head on the water.
How about another round of applause for our teams here? Great job. We're going to get two of the members to come up so we can do a quick interview. Guys, thank you. What's your name? Colette, thank you.
CJ.
CJ, thank you very much.
You're welcome.
Great job. Take a deep breath.
Yeah.
How you feel?
That was a little overwhelming. A little bit.
Okay, so tell me about the overwhelming. When you came through the doors, right? As soon as you walked through the doors, you looked up on stage. What was going through your mind?
We didn't know which special event that we were going to, so there was a lot of options about how many patients that we could have had. Even at a conference like this, you could be dealing with a couple hundred patients. So that was definitely something in the back of our mind of our resources that we had. And then as soon as you hear fire, how many people are involved, any type of burn injuries that we could have been looking out for, some type of airway compromise, those were like the initial thoughts going through our head.
So I saw you went right to the child, and that's always a little bit unnerving. What were you presented with? What did you think as soon as you were presented with the child?
Anytime you see a young child that's reported to be not breathing, automatically raises a lot of red flags for a really critical patient, and then you managing that was going to require a lot of hands on deck.
Absolutely. CJ, you came over and you went, how did you decide how you're going to split up on this?
So we didn't really, there was no predetermined kind of routine. When we were coming up, I noticed that Colette was doing chest compressions on, I didn't know it was a child at that point. It was just kind of just the way we went up on stage. Like Matt had the opportunity to go up to the front, and it was something that we talked about initially. We were going to make contact with the EMTs and figure out how many patients there were, what their acuity was, and it seemed just from like the initial scene size up that we had two pretty clear ALS patients, and two kind of quasi BLS, maybe ALS. So I think the most important thing was just go over, make contact with them because they had established they were the two sickest patients because they were attached to them, kind of figure out what's going on, and then just roll from there.
Talk a little bit about your patient and the burn situation and what we were thinking about as you were treating.
Yeah, so burns are tough. They're a very gruesome appearing injury, and they can bring a lot of complications, volume loss, heat loss, airway compromise. You just kind of do like a quick head to toe, and he obviously had very significant burns with some potential airway compromise. We got him on the life pack. He was hypoxic. Had I listened to lung sounds earlier, I probably would have heard some bronchospasm, some stridor, a lot of constriction. So it's really important to get in those patients and place an advanced airway immediately. And it's one of those situations where you have to do it the right way, but you have to do it as quickly as possible. So that's why it was taking a little bit longer to get the actual tube in.
And finally, the distractions are always put into this for a reason. How did you figure out a way to put aside those distractions so you could focus on the task at hand?
We tried to assign different roles for the distractors, keep them busy. Ideally, if anybody was CPR trained or something, that could have freed up some hands and trying to assign different jobs so that people who want to help can do something to help. That would have been really helpful to try and do.
Awesome. Well, you guys did a fantastic job, so we want to thank you again for competing, and job well done. Thank you. Thanks, guys. Thank you. Thanks. Thank you. Yep. All right, what we're going to do now is we're going to bring up the good doctor, Joe Catoro, to go over a little bit about what the scenario was, and really specifically about what foxglove was, which is what the child actually was toxic with. So, Doc, thanks for coming up. You have your hand held?
I appreciate you having me again, Mike.
Absolutely. So, tell me a little bit about foxglove, because I don't think everybody really knows what that is. It's kind of a unique situation. Why is it poisonous?
So it's probably one of the more common plants in North America that are poisonous, and it's referred to as a cardiac glycoside, very similar to digitalis or digoxin. We don't use digoxin much anymore because we have better medicines, but you will find patients who are still on it. But this medicine works at the heart to change how calcium gets regulated.
Okay.
And it can cause a lot of clinical problems with heart blocks and cardiogenic shock.
How would EMS know or suspect this in a patient?
Right. It would be very difficult if you didn't have some clues. It can be ingested. Oftentimes, patients will take this and mislabel it or mistake it for another plant that's often used in cooking. And we see that a lot in toxicology, where people are foraging for wild mushrooms and end up with a toxic mushroom. So asking questions like, are they eating anything out of the wild, or are they into that kind of thing? And obviously, if there's leaves or plants or stems on there, then that would be a dead giveaway.
Recognizing it's one thing, obviously a treatment modality is the second. So how would we initially treat this type of patient?
So this can be challenging to treat, especially in the EMS. In the emergency department, we would give what's called digibind, which is a monoclonal antibody fragment that would bind up the poison. And if it got bad enough, we can dialyze them. But this is all about perfusion. And the patients are going to have low blood pressures, low heart rates, low oxygen saturations. And we're going to have to support them. So primarily, we would pace them. We want to try and avoid things that are going to raise the heart rate with pharmacologic mechanisms like levophed or epinephrine, because they can potentiate ventricular tachycardia. And then there's a debate about whether or not calcium should be avoided, because giving calcium to these folks can precipitate what's called stone heart, where the heart just goes in asystole and you can't get it out.
What's the definitive treatment for this?
It's the digibind plus or minus dialysis.
So supportive initially, pace them, get them to the hospital, and then get them to the appropriate.
I think the big takeaway from EMS too is if you have a known digoxin overdose or a known cardiac glycoside like foxglove, medicine's become very subspecialized, and there's pediatric centers and there's heart failure centers, and every pharmacy is going to have this medicine available, and time is of the essence. So going to their closest hospital. This is one of the times where the closest hospital really is the most appropriate hospital, because if you get that on quickly, you'll start saving that patient's life, as opposed to driving another 30, 40 minutes to get to a pediatric center or another center with a larger capability.
Doc, as always, thank you.
Thanks.
Oh, nice job there. All right, folks, we are ready for our third team. Our third team, BLS, is Team Overrun. And our ALS team from University Hospital in Newark.
Team overrun.
Dispatch to Team Overrun. Respond anywhere Township, New Jersey, County Road 579, 579, to the Happy Catawba Farm for the special event standby.
Right there.
Hey, you be okay. You sit here by the fire, you get warm. I'm gonna go see what our grandson is over to.
Excuse me. Excuse me, sir. Sir.
What?
It's cold out. Can you turn the fire on?
It's December.
So?
Turn the fire on? Yeah, I gotta find the switch.
It's something. She's pregnant.
Yeah.
We're cold.
Really? Pregnant? I mean, we're all the same, okay? You wanna hit the switch?
Help.
Hit the switch on what?
The switch for the fire.
What?
They're saying they're
Just
cold.
light the fire. I'm sorry. We shouldn't have gone to this place.
Listen, all right.
No, wood.
No,
Wood.
This is fine. I've done this before.
Thank you.
Not so much of it. Oh, really? God, really?
I don't know what happened.
County received Team Overrun on scene.
Listen,
This guy's on fire.
help.
What's your name?
Just relax.
Not telling me his name. Ow! Well, then help him.
No, you help him. You put him on fire. Put it out.
My hands are burning. Can you help?
I don't know what to do. I'm not
He
gonna
is the
touch
dumbest
him.
person in the world. You hired him anyway.
Guess what? You shouldn't even be here, okay? Your time's coming.
Stay awake, buddy. Stay awake.
Can someone help my wife? She twisted her ankle.
Sir, calm down. Call for help, all right? I don't know why you're...
I already went.
It's all under
30 minutes.
control.
Okay,
All under control.
Somebody's coming. Hey, put him out.
I'm putting him out. What do you want me to put him out? Get the hose.
Have a hose. You did this. You started this.
Oh, thank God.
Where's the other patient?
My wife, she twisted her ankle. She's pregnant. She's 37.
Okay.
Burn him over here.
Where's the other burn? If you could walk, come to me.
Oh, can you help my wife?
Okay.
Be arrested.
Okay.
He does
Hi.
not need to be arrested. He is not
Your hands burn? All right.
He's on
Can
fire.
I get paramedics?
His beans are burned.
Does he have a pulse?
I don't know how to check
ALS
right now, but my hands are killing me.
Okay.
He's not talking.
Received ALS 3.
Did you always pour this amount on?
I think his eyelashes are burned off,
Uh-huh.
but he's still moving.
Spiked it with what? Gasoline is an accelerant.
All right.
What are you going to give him a name tag?
Yeah. Right now, there's...
Are your hands okay? Can you get away from
Yes,
the
he's
fire?
going to be okay.
But he's still smoking.
Here. Hold this.
You're gonna get burned. Move yourself away from
Yeah,
the
get
fire.
away from the fire, sir.
Yeah, I'll hold it. Yeah, exactly.
Can I get medics?
Dude, can you
All
hear
right.
me? Can you hear me? I don't think he's talking, man. But he's still smoking.
They got a pulse.
But we know his name is Steve. Oh my God. Can you get the stuff off of him?
Is this bleeding control? What's
Dispatch
that?
to ALS 3. Respond
Okay.
anywhere Township, New Jersey,
gotta
County
get
Road
him over
579,
there,
579, to the Happy Catawba Farm for the incident.
How's the bleeding on this leg?
Can you hear me?
How's the bleeding on
What's
this
your
leg?
husband's name?
Controlled? Okay. What about on that?
Steve!
Okay.
Steve, can you hear me? Dude, he's making all kinds of sounds. Dude, I can't really get all the rest of this. My hands are hurting.
Okay.
She was like, she was laying on the floor or something.
What?
What are you trying to go sit down?
I can't. I'm trying to help it to get this guy out.
Wait for my. Okay.
Look at your hands.
How does this split work?
Oh my God. How did this happen?
He got set on
How
fire.
did it happen? Walter.
I didn't do it.
Walter, come on.
You know,
We have to go to the same hospital as my grandson over there, please. We have to go to the same hospital.
Sir, you go wash your hands for 1 second. Okay.
I got him.
Can you get it away?
No, I'm holding bandages. Give me some other, get the first aid kit or something. So
Here. Your hands are burning. Let me put some water. Let me put some water on your hands. Dump it on the floor. Here, put that on your hand.
Excuse me.
I need ALS over here for the burns.
Okay, how many patients do you have? I'm Brittany. This is my partner, John, from
We
university.
have 3 right now. This is the red tag.
Red tag?
He got burned by the fire. He's not acting appropriately.
Do me a favor, give this to my partner. Let me start my assessment.
My hands are burned too.
Oh, you're giving out ankle.
Yes.
Twisted her ankle.
Guys,
get away from me.
What happened?
They said that man
Okay.
Okay. What did you trip over? Okay.
Okay. Do me a favor. Can you go get me a blanket or something so I can cover him?
Yeah, Gene, just go get a blanket.
You want to be helpful for your friend? That would be helpful for me.
It wasn't NDA.
What is your relationship to him?
No, sir.
What is his name?
Okay, how many
Walter,
weeks
do
is
you
it?
know anything
Okay,
about
do
his
you still
medical
feel the baby
history?
kicking right now? You don't.
Does he take his medication?
Okay.
When's the last time you saw the
If
doctor?
you're-
Yes, sir. Give me one moment.
Am I seeing any like deformity, any bleeding?
When's the last time he saw the
Just
doctor to
swollen?
adjust his medication?
Okay.
He doesn't need any adjustments, but
Do I feel
when he's
okay? I'm gonna take off your
Okay.
shoe, okay?
Good work takes time.
You burnt my hand.
Do you actually want to
Allergies to medicine? Has he drank any alcohol?
So right now we have.
Take my shoes off too.
Watch your hands. I don't?
Can you feel me
Okay.
touching your foot? Can you wiggle your toes?
You can wait 1
Okay.
second and you can be one of
I
my
have a
wonderful
green flag over here.
helpers. Can you tell me what happened here today?
No. No. This one?
Poison
Stable,
where?
yeah.
Show me where, lovey.
Okay. I'm gonna go grab my blood pressure cuff. I'm gonna come right back and do your vitals, okay? Yeah.
No, I know.
Where am I plugging this in? We are handling as best as possible.
As of right now, we have 4 patients. We have this guy. We have a guy with burns onto the hands. I have an ankle injury and an unresponsive.
Okay, this one's going to be a level 2 at this moment.
Okay. I'm gonna go. Do you need any hands right now?
I can't find the plug on this.
Are you okay?
1 second.
I have emphysema.
Okay. Let's go sit somewhere.
SpO2, check her lung sounds, even though she's on
Yeah.
book.
Let's go take a seat.
I want to go check on my grandson.
Okay. Well, let's go have a seat over here, okay? Let me check you out. All right. You want to sit right here? Come here, sweetheart. Have a seat over here.
Just have her sit straight down.
Sit. Sit.
Do you have a full story? Christian, full story?
He got lit on
Exposure?
fire with the fire.
From what? That's it? Playing with
Good job.
gasoline or anything? Alcohol into the fire. Okay. Chem stick?
Please, what's going on?
Chem stick, glucose?
Grandson.
All right.
Besides emphysema, anything else? When did your shortness of breath start?
Right now.
Okay.
Yes, my BLS requested.
They did? How long will the cops? Yeah, when are they going to be here?
Sir, give me 5 minutes. I'm checking out patients.
5 minutes? I don't have 5 minutes. What's going on here? We need the cops.
How much oxygen are you normally on right now?
Are any of you guys going to look at him?
Okay.
Just stay seated, okay?
I want to check on my grandson. Let me check on my grandson.
Right now, the paramedics are working on him, okay? I gotta make
He did. Why would he have done such a thing? Can you tell me?
Let me make sure you're
No.
okay as well,
What do you
okay?
need tape for, love?
I'm gonna do your blood pressure.
Okay. So let me help this friend here
We'll take
first.
your
and then- Oh, he's a customer.
Right now, the paramedics are working on him, okay?
Hey guys, Guys, do me a favor. Can you make sure nobody comes in and out of that way so nobody gets hurt? And I'm going to help you in a moment.
No one's coming. Okay, so can you
Do me a favor. Stand up. Stand over there. I need to have you do that really special job.
Please take them.
Yes. Yeah, I'm good. Unequal pupils, not responsive to painful stimuli. Lungs are good. Keeping it going.
Your blood pressure, everything looks to be normal, okay? Let me just have you be seated. Come over here.
Parker says you have ice packs over here.
Oh, the ice pack. We got an ice
I
pack.
got you an ice pack. Okay.
That was
Can you be... Sweetheart, come over here with me.
I'm staying with him.
Sweetheart, right now they have to do what they need to do.
They need to do that ice pack, right? Can I see it?
Can I use this for his burned hands?
Please.
All right, put them together.
Okay.
Can we do
No.
something with his hands? I need him to work tomorrow.
My hands are burnt. I got skin peeling off of them.
Yeah. Is he gonna be able to come in tomorrow?
He's gonna go to the
Can you
hospital.
let
The
me
hospital
help
will
him
do what they
first?
have to do, okay?
The best of my ability. We
Put
did.
water on it.
They're real. I mean, they're
Okay.
real sore, right? You know.
Okay.
I mean, they're both
And
of them.
who are you in this equation? What's your name?
So I hold like this.
Just
Your
hold it
name's
like that
Brandon?
right now.
You
okay?
work here? Okay.
I'll be back.
Did you see anything suspicious?
Yeah, they're okay, and I'll be right back.
Tell me. Okay. Who did? Okay, don't point your finger so we can protect the integrity of your safety, okay? Yeah.
Can we get you over here?
I cannot tell you that answer, but I will make sure that we do everything possible to keep you safe.
Can you take my wife to the hospital?
Which one's your wife?
And she's got a twisted ankle.
Okay.
What are you doing now?
I have a guy with a burned hands. I'll give him some water.
Trauma's on the side.
No, I just need I'm gonna get another 2 BLS.
Recycled pressure?
That's what I do. I'm a helper.
Okay. Okay.
Can you just take her to the hospital? Wait, he's got an ice pack. You took
Give it to me.
You gave
Give me the ice
I
pack.
gave her another ice pack, sir.
That's a hell of a woman you got there.
I'm gonna check your blood, your vitals, okay?
Hey,
John, how are you doing over there?
is that yours?
Do I get as your heart rate? Whatever.
Johnny,
I get. Okay.
how are you doing over there?
How's your oxygen? Yeah, we're good. It's good.
All right.
It's good. Strong and regular. Let me check your blood pressure.
I really don't want to deliver the baby here. This would be a terrible story.
I can do it. I can do it.
He delivers cows, he said. He said he takes the cows out of the cow. He needs his help.
Just before the baby comes, though, she give her water. She'll give water.
She gave me water this morning. Does that mean the baby's coming?
Recycled pressure?
It was like a bowl of spring bottle.
Do you have anything for pain for my employee?
Who is your employee?
The guy with the burned hands.
What is his first name?
I'm gonna need
Gilbert?
BLS. One for
Okay,
the twisted
just give
ankle,
me
one
a
for
minute
the-
here.
And PD for this.
I heard you. Something for pain management.
Okay. We'll come with me, sir.
I didn't do anything.
Sorry?
I'm gonna check out your hands.
You just said I was getting arrested.
I didn't say you were.
You're getting arrested?
It still hurts.
He's still not talking.
Do you still want us to give her the apple? Give her an apple to take to keep the doctor away.
Don't give her the apple to eat right now, okay?
Bring them to the same
No apple.
right?
We're going to
How do
take
you
him to
feel
the
with the
closest,
water?
most appropriate hospital.
But my grandson and my husband, they have to go to the same hospital.
No.
Sometimes people need to go to different hospitals because they need specialized care. Do you want me to treat your family like my
So I'm
family?
seeing, like, is it actually like? So I put some water on there. Did the ice help at all?
Not.
I'm
Do you have any, like, drugs?
I personally don't. The paramedics right now are working.
Did she say PD's coming?
She meant pediatric.
Any updates? Chris?
Yes.
Updates? Anything pertinent I need to know behind me?
I have him, who's apparently the threat, complaining of burn hands that's healing. I
PD?
have her with an ankle injury. Vitals are all stable.
PD is still coming?
And then they have a pediatric cardiac arrest over there.
I didn't threaten anybody. You said I threatened somebody?
No, not that I heard, sir. Sir, how's your pain right now?
It's a lot.
It's a lot? I'm so sorry to hear that. Recycle blood pressure?
Right now, sweetheart, we're dealing with multiple patients. Okay?
Oh, that's, I love that for
We're
you.
taking to the same hospital. Just give us a little bit, okay? How do you feel with the ice pack in the water?
What are all those lines?
Special rhythms.
All right, come
Special
talk to
rhythms to
me,
see his
okay?
heart. Can you? Oh.
I want to
94. Sorry.
All right, we'll come over here. Just have a seat right here, okay?
Oh, you brought her another ice pack?
No.
You brought
All right.
What'd you do to him? You just pushed him in the flood.
I got it.
Are you okay?
I got it.
Is there anything else going now? Oh, okay. The cops are on their way.
Officer, doctor,
I'm not an officer, I'm just medical.
Can you help my wife's ankle?
He can't do anything. I just want to go get checked out. It's his fault.
Do you have handcuffs?
We have another
Listen,
we need
ambulance
to arrest
coming,
this
okay?
man.
With a dead kid and a dead adult, this place is getting shut down.
John. Good?
And Dex, good job.
Oh, yes. How are you? You don't, that's okay. You don't need it. What's your name, sir? Christian and Brittany. Take a deep breath. Breathe, Queen. That's right. How do you feel?
I'm okay.
You're all right.
Yeah, I'm all right.
Now that it's over. Yeah, people are excited about you being all right.
Hello, Brick City. And
The
special
universe.
hello to Team Honey Badger in Matsu, Alaska.
All right, Brittany, question for you. What were some of the biggest challenges in this scenario that you faced, and how did you overcome them?
I think there's always the distraction, but we're always good in that in the city I serve, having multiple avenues coming at you at all different angles, focusing on your patients, getting the proper information from your BLS, as well as those people coming in that think they're being helpful as a bystander, and sometimes you're just not, but you have to acknowledge them. Customer service smile with high performance sometimes.
For sure. Christian, when you came through the doors initially and you saw the scene, right? You were the first responders in. What were your thoughts as you were trying to process what it is you were going to and how you're going to attack this?
Well, first I wanted to know how many patients, what was going on over here, because I did see a lot of people. Where were my patients? What was going on? What was going on at this farm? So we kind of had an idea.
Same question to you. What were some of the biggest challenges that you had from a BLS perspective when you got in, and how did you overcome that?
Definitely the bystanders that were just getting in the way, because they're always going to be the biggest distraction to you, to make sure that they kind of guide you off the wrong path. It's just a plot twist, but it happens in real life too.
Sure. Brittany, I know you had the burn patient, and obviously burn, there's a lot of considerations that go into that. What were some of the things that you were thinking of and considering, knowing that when you got up there, this was a burn victim?
Knowing it's a burn patient, the first thing we always think about, yes, I speak English, the first thing we think about is where are the burns? Are they going to affect the airway? Do we have the fluid replaced? Do we want to do it fast? Do we want to do it judiciously? Because we don't want to overload somebody, especially if we don't know their history. So there's a lot of things to consider while also maintaining our safety so ourselves don't become burn patients, because we don't know what could happen, right? We never assume.
For sure. Guys, you did a fantastic job. I want to congratulate you both. Thanks for competing. Great job. Great job. And here she comes with a slow jog.
If you could turn your mics over to you could cut right in front. Okay. Hi.
Hi. What'd you think?
What's new? Well, we're going to have a winner tomorrow night for sure, and we're going to reveal that at the awards ceremony, which we hope everybody will join us for. 6 o'clock cocktail hour, live streamed at 7 p.m. Same channel.
Same channel. We want to thank all of the competition teams tonight for putting out an incredible performance. Let's give them a round of applause. We also want to thank the 579 team, who always does an unbelievable job in acting.
They do.
So let's give them a round of applause as well.
They do. And I want to invite the 6 teams who are still in the room for 2 things. One, a team picture with us, but then also a debrief opportunity where you can hear from the judges and have a huddle to break down the clinical side of the cases. And for that, I'm going to say this is an amazing moment. Thank you, Michael McCabe, as always.
Jen, thanks for having me, and thank you for coming. We appreciate it. We'll see you all tomorrow at the dinner.